Well, good afternoon, everyone. My name is Courtney Goodwin. I am the social media manager at Prisma Health. On behalf of Prisma Health, we would like to thank you for joining us for another Facebook Live Town Hall. March is Colorectal Cancer Awareness Month, and Prisma Health has joined others in bringing awareness and providing educational information on how to recognize the signs of colon cancer and ways that you can take care of your colon. So today we are bringing you a panel of Prisma Health experts that will answer questions and provide information on colon health. So on our panel today, we have Dr. George Blestel, colon and rectal surgeon and associate professor of surgery in the upstate. We have Dr. Jennifer Fletcher, primary care physician in the upstate, and Lindsay Johnson, GI oncology nurse navigator in the Midlands. So thank you all for joining us today. So we're going to get started with our first question, which will go to Dr. Blestel. So the question for you is colon cancer a risk only for those with family history? And who should be screened?
Thank you for allowing me to be here. Colorectal cancer is not just related to family members. Obviously, there's a genetic component to colorectal cancer that is influenced by environmental factors and other unknown factors. But there's this myth that, since there's no one in my family who has colorectal cancer and I'm having no symptoms, then I'm not at risk, which is not true. About 65% of people who develop colon cancer in their lifetime have no family history. It's easy to explain that in that to have the proper genetic makeup that these environmental influences have in our environment that can develop into colon cancer, that each of us are a unique genetic makeup of a combination of both our mother and our father, which make a unique genetic component that you can develop this genetic propensity to develop colon cancer. And therefore, we're all at risk. But obviously, if you have a family member with colon cancer, the likelihood of you inheriting that part of the gene increases. And that's why people who have colorectal cancer in their family have an increased risk, but all of us are at risk.
Thank you. So why is colon cancer occurring in younger people more often?
The honest answer is that despite there being a lot of research into this, statistically, in the development of screening principles to decrease the incidence of colorectal cancer, statistically, in every age group in the propensity group that were targeted from the age of 50 on up to infinity, that we have reduced the incidence by using colonoscopy and screening methods. But then statistically, when we look, the younger age group tend to have an increase rather than a decrease, partly due to that group has not been screened. Other factors is that is there environmental factors that are now occurring which we're not really sure of, the whole genetic propensity, the new realm of what's called biome, which is the interaction of bacteria and this natural flora that live within our intestinal system, how it reacts to the bowel, and creation of increased propensity of colon cancer are all being studied. But to be honest, we really don't know. But on the other side, as we see this increase, that's the reason why 3 years ago it was decided that we were going to lower the age of screening to 45 and obviously continue to look at these people to try decreasing the incidence. But the honest answer is we really don't know why, but statistically we've seen this and we're continuing to study why that's a fact of these things occurring at an earlier age group.
Thank you, Dr. Blestel. So now we're going to go to Dr. Fletcher. Hi, Dr. Fletcher.
Hi.
So the question for you is, what are some common causes of rectal bleeding?
Sure. There's several causes of rectal bleeding outside of just colorectal cancer. Of course, that's one of them. There's also hemorrhoidal bleeding that can happen. There's some things called diverticula that can occur in patients where the muscle wall gets weaker and it causes little pouches to form. those pouches can spontaneously sometimes bleed, or if they get infected, called diverticulitis, that can cause bleeding. Also, conditions such as inflammatory bowel disease like Crohn's or ulcerative colitis sometimes can present with rectal bleeding. And then lastly, trouble with like the blood vessels and how they're formed, which can be acquired or present at birth, such as hemangiomas and other acquired conditions in the blood vessel anatomy can cause increased propensity for rectal bleeding.
Thank you. So now we're going to move over to our nurse navigator, Lindsay Johnson. Hi, Lindsay, how are you?
Good morning. How are you today?
Good. So your question for you is, when it comes to bowel movements, what's considered normal and when should you be concerned about a problem?
So your bowel movements should be regular, soft, and brown, and you should be going anywhere from once a day or sometimes three or four times a week. But you really should be concerned if your stools are black or red in color or yellow or have a foul smell to them. And you want to report that to the provider.
Mm-hmm. Okay, thank you. All right, Dr. Blestel. The question is, what is genetic testing for colon cancer recommended? When is that recommended for people?
So genetic testing has obviously evolved over the past several years, and for many years, genetic testing was a little tricky in regards to ordering genetic testing because of the fear of losing healthcare coverage in regards to that and having this genetic diagnosis, even though you may not have the disease, but increase the propensity. Obviously, there are laws in place now that protect us in regards to doing that. But there are two major groups of people who should have screening. Obviously, there are these genetic propensity cancers, and the two most common are familial adenomatous polyposis and non-polyposis hereditary colon cancer, or Lynch syndrome. So usually there are criteria for Lynch syndrome, and now because of family history and other cancers, we've recognized this group of people who are potentially have these diseases, and with the aid of genetic testing, can pinpoint that. And obviously, in siblings and children, that obviously they can be made aware of being screened and assessed at an earlier age by doing it. So usually genetic testing in familial adenomatous polyposis, there's obviously family members, and it happens at a very young age. And again, children are then susceptible to developing this in their teenage years and start their screening process. With the aid of genetic testing, it can rule out that these siblings or children have the genetic propensity and not go through this rigorous screening process of doing colonoscopies and other testing every year to every other year, to when they don't have this genetic propensity that they can go to a high risk, but not this extreme high risk where they're undergoing screening examinations on a yearly basis to decrease the propensity to have complications from, colonoscopies, despite it being a safe examination, do have risks. And these other tests and the expense of doing these things, that genetic testing in those two specific groups of people, hereditary non-polyposis colon cancer and familial adenomatous polyposis, are the two main reasons where we do genetic testing. Obviously, with the advent of surgery and not just doing the microscopic evaluation by doing staining and genetic testing, we can identify these genetic abnormalities and then screen people, or then recommend that patients' families, after making that diagnosis, undergoing surgery and looking at their pathology report, to say, hey, you need to get your children and siblings checked because of this genetic abnormality that you may have.
Thank you. That was great information. So Dr. Fletcher, does colon cancer tend to be more aggressive in younger people? And if so, why?
Yes, it certainly can be. I think it kind of goes back to that question earlier that Dr. Blestel answered. Some of this, they're not really sure yet. There's still a lot of research out there. It could be from, genetic predisposition, or it could be the delay of diagnosis. Sometimes that happens because patients aren't as apt to come in and get checked out. They don't think that they're really at risk for colon cancer because they're at a young age. Therefore, it delays the time to the diagnosis. So the cancer is just already more advanced by the time they're diagnosed. And I think furthermore, sometimes it's tricky as a clinician too. Some patients present with very benign symptoms that aren't always like maybe the older population that may have weight loss that's profound, or iron deficiency anemia, or rectal bleeding. They may present with a little bit more subtle signs and symptoms. So it's harder to get that diagnosis early on sometimes in patients that are younger. And then also there's been some research done into the molecular aspect of these cancers in the early onset colorectal cancer groups. There's been some early genetic studies in the tumors that these are different than those that you see in later in life tumors that are associated with colorectal cancer. And so there's still a lot of ongoing research to see if maybe that predisposition of those types of tumors just is more aggressive as well.
Right. Thank you. All right, Lindsay, if you're pretty sure the bleeding is caused by hemorrhoids, how can you treat yourself at home?
Well, mild cases often can be managed at home by doing such remedies as taking sitz baths or applying hemorrhoidal creams, drinking more water, and definitely exercising regularly.
Mm-hmm. So is that painful, the process of, of course, dealing with it, but then also, treating yourself at home? Any type of tips or recommendations?
You definitely just want to, of course, just looking at your bottom regularly and then assessing if you have more bleeding, then you definitely want to report that to your physician. But just doing some of those small things can help with the immediate symptoms and relieving that at home before it progresses to something worse.
Right. Okay. Thank you. All right. Dr. Blestel, what causes diarrhea and constipation?
So obviously, we could open up a textbook of the sources of constipation and diarrhea, but plain and simple, easy answer to this question is that the function of the colon is truly as a storage depot, and that the lining of the colon absorbs water to make the stool formed. When the byproducts of digestion reach the colon to be stored, that we can eliminate our waste products on a regular basis and not just having continual bowel movements, that it acts as a storage zone for our waste products. And the way that it does is by this liquid content that is introduced into the colon. The water is then absorbed, having formed stool. So the most common cause of diarrhea would be the lack of absorption of water. And therefore, with the lack of absorption of water, the stool is more loose and have multiple loose episodes of diarrhea. For the most part, in constipation, it's probably the opposite. Obviously, the lack of fluid intake, and obviously, the most common thing that we see are medications that tend to slow the propulsion of things through the colon, which then cause constipation. Obviously, if you look at the package insert of almost any medication that we take, and if you look at the side effects, almost every drug that we ingest into our body, one of the first lines is bowel alteration, either constipation or diarrhea in regard to that. So medications play a significant role, and obviously dietary factors by the lack of fiber in our diet, which tends to hold water in. Again, things become constipated because the form of function of fiber is to hold water in and make the stool bulkier rather than being so firm and being brick-like and having problems with constipation.
Yeah. So for someone who is often, constipated, is it okay to regularly use laxatives?
So the answer is without a workup. Obviously, if you look at the package insert of over-the-counter medications for treatment of laxatives, such as laxatives and even antidiarrheals, if you read into those inserts that short-term use of those things for an intermittent episode of bowel irregularity, whether it be constipation or diarrhea, is a reasonable thing to do. But if it's persistent, then obviously it may be a warning sign that without proper workup of investigating the cause of this, we would not recommend that somebody do this on a regular basis without the guidance of their physician in regards to management of that and a proper workup to rule out that there's anything dangerous or life-threatening causing these symptoms.
Thank you. All right, Dr. Fletcher. If you're younger than 45 and have a family history of colon cancer, should you get screened, and what screening should you get?
Absolutely. If you're younger than 45 and have, for instance, like a first degree relative, a mother, father, sister, or brother who had colorectal cancer, you would want to get screened at age 40 or 10 years before the age that that family member was diagnosed.
Thank you. All right, move over to our nurse navigator. This question for you is, do most young people with colon cancer have a family history?
So as many as 1 in 3 people that develop the colorectal cancer have other family members who have actually had it.
Okay. All right, so let's go back to Dr. Blestel. All right, Dr. Blestel, the question for you is, how can you prevent hemorrhoids?
So to answer that question specifically is hemorrhoids are not preventable. People are born with hemorrhoids, but what typically people will make their own diagnosis of hemorrhoids is when their hemorrhoids become symptomatic, causing one of 3 symptoms: pain, bleeding, or protrusion. So we're all, unless you've had your hemorrhoids removed, we all have hemorrhoids. But typically, when people say that they've developed hemorrhoids, what they're really saying is their hemorrhoids have become abnormal to the point that they're causing symptoms. Obviously, there are things that potentiate the development of symptoms, and the most common things are bowel irregularity, straining, abnormal physical activity to where people hold their breath and push against their abdominal wall, cause a Valsalva maneuver, which increases the pressure in these blood vessels, which make the hemorrhoidal tissue protrude out and become engorged, causing bleeding and protrusion. So obviously the keys to prevention symptomatology or controlling symptomatology are bowel regularity and avoidance of strenuous activity and using Valsalva maneuvers, which will increase the pressures into these vessels, causing abnormalities.
Right. So with that being said, can any type of color or a certain type of smell and type, in the stool, can that indicate a health problem?
Yes, it can. Obviously, dark stool, foul-smelling stool, odors that are not usual, that are very distinct and causing a noticeable change to say that obviously this is not normal for me. So obviously dark black tarry stools, maroon, dark or bright red blood or blood looking material within the stool are obviously worrisome conditions. There are other organ issues that with the lack of bile salts from obstruction of the liver or pancreatic insufficiencies can cause changes in the color, consistency, and the odors in the bowel, which mandate a workup to identify the cause of these changes.
Thank you. Thanks, Dr. Fletcher. Someone who may be experiencing, colon issues, they may want to try, different things like a colon cleanse. So what is a colon cleanse, and is it helpful or harmful?
So there's a couple of different colon cleanses that are out there. Some patients use like an herbal supplement type of concoction to do a colon cleanse. Other people use a device that's like a tube that's inserted to the rectum, and they actually put water into the colon to let it sit and then flush it out. As far as like scientific research, I've not been able to find any support for using these types of techniques. Of course, if this is something that a patient is particularly interested in, I would recommend that anybody discuss it with your provider, your medical provider, because there are risks that can occur. For instance, with the fluid shifting that can happen with these cleanses, you can have electrolyte abnormalities, especially in patients with heart and kidney disease. This can be a serious side effect. Furthermore, if you're inserting like the tube, then you can have a tear at that area or an infection that develops. So it's certainly not without risk.
Thank you. All right, Lindsay, we're going to go back to you. So does insurance cover a screening colonoscopy if you're under 45 and have a family history?
So most health insurances will cover a colonoscopy for high-risk people under the age of 45 when it's recommended by the medical expert. But it's not fully, it won't cover it 100%. So it's best that you check with that insurance company so you won't be surprised by any unexpected co-pays.
Mm-hmm. Thank you. All right, Dr. Blestel. So what are the warning signs of colon cancer that people should look out for?
So the most common warning signs that we would warn patients about in undergoing screening and their follow-up after undergoing screening are a change in your bowel habits. Obviously, the norm is different for individuals from multiple bowel movements per day to one bowel movement every week or so and things like that, which are potentially normal to people. But what we're looking for is change, meaning a change in their bowel habits that's not usual, a single episode of gastroenteritis or a single bout of constipation because we changed some medication or we've been sedentary for whatever reasons, whether it be recovering from surgery or we're taking narcotics and things like that. But it's a change, meaning we've noticed a significant change in my bowel habits. We've noticed bleeding. We've noticed abdominal pain that's not just a intermittent episode, but has been persistent. Unexplained weight loss and unexplained loss of appetite are obviously warning signs. Obviously, in checking people in their routine labs where they're have a significant anemia where the amount of blood in their system has drifted down to the point that a lot of people say, well, I'm not very symptomatic. I've not noticed any bleeding. But again, a small little amount of blood loss over a specific amount of time, the body accommodates for that, just as though if you had a drip in your sink and you really didn't notice it and you got your water bill and you realized how much water has been used from that drip. Obviously, those things show up in routine health screening exams where someone has a significant lowering of their blood count, which is a warning sign that they've lost some blood, which warrants further investigation. So the major things that we would warn people about: a change in their bowel habits, rectal bleeding, abdominal pain, unexplained weight loss, unexplained loss of appetite, obviously warrant investigation or at least discussion with your physician to decide is further workup warranted, checking a blood count, doing a colonoscopy if it's not been done in a recent past, or doing some other diagnostic examinations to identify why these things are occurring.
Thank you. So when I know you mentioned the rectal bleeding. So, like when should you be like concerned and when should you seek that treatment from a healthcare provider?
So obviously, all of us have periodically noticed a little episode of bleeding, some blood on the tissue paper, or maybe a couple of drops in the blood or on the stool and things like that that are intermittent. Obviously, frequently we will sort of justify those things and saying that, well, I've had a little bowel irregularity or this will pass. Obviously, if it's persistent, a lot of people will say, if this is persistent more than 10 days to 2 weeks, obviously it warrants a workup. Now, obviously, there are people who have symptomatic hemorrhoids who continue to have multiple episodes of bleeding and not necessarily need to undergo a hemorrhoidectomy or surgical intervention to do it. But again, a good workup to clear the air that is this bleeding truly coming from their hemorrhoids or some other source, and having a colonoscopy or having some diagnostic workup to rule out that there's not another source other than their hemorrhoidal bleeding that can be managed and will intermittently have some bleeding. But what we don't want people to have is this false sense of security to say, oh, it's just coming from my hemorrhoids without a proper workup and diagnosis to rule out the source of something that may be potentially life-threatening.
Thank you. All right, Dr. Fletcher, the question for you is, are you more at risk for colon cancer if you have inflammatory bowel disease?
Yes, absolutely. There's about a 6 to 7-fold increase in that patient population as with like Crohn's and ulcerative colitis for developing colorectal cancer. Typically, they recommend a screening colonoscopy once the patient's in remission, and then usually at like 8 years of the disease process, and usually every year, 1 to 3 years, depending on the patient risk factors, severity of disease, And it's a lot more complicated on how they decide if you're the 1 or every 3-year screening. It's based on patient particular case.
Thank you. All right, well, I believe that's all the questions that we have for today. I want to thank all of our experts for joining us. So what I would like to do at this moment is just get any final thoughts from all of our experts. So Lindsay, I will start with you to get your final thoughts.
Thank you for having me today. I just want to say it's just important to make sure you do your regular checkups, maintain a healthy diet, drink plenty of water, exercise, be as active as you can, just to try to help prevent a lot of these things. Sometimes your family history is working against you, but if you try to do those basic things, I think that'll help you with having good colon health. So.
Thank you. All right, Dr. Blestel, do you have any final thoughts to include?
Obviously, being the end of the line in regards to when people are diagnosed with colon cancer and have to look someone in the face and tell them that they're going to have to face surgery, potentially chemotherapy, radiation therapy. Getting screened is the key. Obviously, not ignoring signs, which again goes out of the realm of screening, which is basically diagnosis. So obviously, anytime someone has symptoms, the discussion of whether they need further diagnostic examinations are mandatory. But again, what we don't want to do is understand that screening is for people who have no symptoms. We're trying to prevent the development of colon cancer, and having one of these screening modalities, obviously colonoscopy is one of the screening modalities, but there are other methods, Cologuard testing, fecal occult blood testing, X-ray studies by doing virtual colonoscopies are all methods of identifying precancerous lesions and prevention of colon cancer or early detection to increase the likelihood of cure.
Thank you. I know you just gave your final thoughts, but we do have a question that came in. Is colonoscopy the preferred screening method, or is there a non-invasive screening test we should advertise for to be helpful?
So if you look in today's world as far as the gold standard or the thing that gives the best bang for the buck, so to speak, meaning is it the best test available in today's world? By far, colonoscopy is probably the superior examination. On the other side, any screening examination is better than no screening examination at all. The problem is that only about 67% of people who are in the screening field, meaning who fit the criteria to undergo screening colonoscopies. Therefore, the development of these alternative tests, such as Cologuard test, which is identifying blood and abnormal DNA in the stool to identify people who are at risk, who should have a further evaluation, is a great method, and it's a very good test. The downside to it is that there have been some false positives. There's been a few false negatives, meaning that, hey, the examination was negative, I'm clear, and then ended up having a cancer, which is extremely rare. Or, hey, I've had this test and it's positive. I went through a total examination and everything is fine. Why was this test positive? Which we don't have great explanations for. But again, any test is better than none. But in today's world, colonoscopy is still the gold standard that we'd recommend to get the best diagnosis. The other advantage of colonoscopies is that it can be therapeutic. When a polyp is found, which is basically the source of these benign lesions that have left in the colon, which are asymptomatic, or the development into a cancer, meaning these benign polyps, the cancer forms within the polyp, then grows into the wall of the colon and spread elsewhere. If we can remove these polyps, which can be done at the time of the colonoscopy rather than these non-invasive tests, we can prevent the development of colon cancer by removing these polyps.
Thank you for answering that question. All right, Dr. Fletcher, if you want to provide your final thought before we wrap up.
Sure. Just from a primary care standpoint, just encourage everybody to talk with your provider about making sure you're up to date on all your screenings, including your colonoscopy if you're within that risk category group. And of course, if you ever have any questions or concerns about your bowel habits or changes or any concerns at all, please feel free to always talk with your provider so they can help guide you to the next best step for your workup.
Thank you. All right. Well, thank you to our experts for joining us today. For our audience online, if you have any questions, please leave them in the comments and we'll respond as soon as possible. If you would like to schedule an appointment with our providers here online, please visit our website for more information. Thank you and have a great day.